what does one expect in, when you go in for an intervention, endovascular procedure with the wires and balloons, and what questions should a patient ask before they go in for those procedures, and even in choosing the right doctor to do the procedure?
Right. So every patient's experience is different. Okay. There is obviously, if you're going through a surgery, even if it is minimally invasive, you are in a sort of an alien space. You're covered head to toe with this blue drape, and you have people talking about you, but you can't really understand what is going on. So all of that is sort of expected. Many patients have sort of different experience. So let me just tell you, there are a couple of steps where you may have discomfort and what to expect. Okay. So the first thing is, when you come for a procedure, whether it is in the hospital or OBL or surgery center, you're going to have nurses, they're going to undress you. They'll put some IVs, get your vital signs, and get you prepped. They'll shave your groin. So it's, sort of a dirty bikini, Brazilian waxing, but it is done, right? So after the prep, you're taken into the cath lab where they will clean both of your groins. And if the doctor is planning on going from the foot, they might, clean the entire leg, which is being worked on, keep the foot exposed. And then, they will call a timeout where they will say, it's this so-and-so, and this is a procedure. And then the doctor will give orders for sedation. Typically, when we do these procedures, we don't we don't put patients to full sleep. Some doctors do that in the hospital. They'll put it under general anesthesia. I think that just increases the risk. Very, very few patients really need general anesthesia. But typically, we will give you Versed and fentanyl. So Versed is a sedative, and fentanyl is a short-acting painkiller. And that's to keep you very comfortable, okay? And the idea is that you should be comfortable enough, but at the same time be able to talk to the physician and your nurses and respond to their questions. And also, we don't want too much sedation, which can then, cause drop in your blood pressure or respiratory rate, especially if you have sleep apnea, things like that. Okay. So once you're sedated, the doctor will come in and they will get access, whether it is the left groin or right groin, depending on what they're planning on doing. So this is the first step where you will have some discomfort, because this is a step where we're going to inject lidocaine to numb the area. Okay. So it's kind of like going to the dentist. There is intense burning. And typically, within 3 to 4 minutes, the area gets pretty numb and you should not really feel anything. Then, once you have the area numb, we typically take a needle and puncture the artery and then put a little tube in the artery. So that's the step where some patients will feel a little pressure. And if patients have had multiple interventions and they've had, scar tissue, then that can be a little bit uncomfortable. But after that, you really should not have any pain, for the angiography. Now, many patients, when you inject contrast, and especially if it's a bolus of contrast, you will feel a warm sensation in your body. Some people feel that they may have actually peed, but that's not the case. And you know what? In reality, even if you peed, what the hell? I can't see it. You
I
can't see
had
it.
that.
It's,
I
it's
have to tell you, Dr. Gupta, I'm so glad to hear you say that, because literally 2.5 years into working with peripheral artery disease and everyone having their CT scans, not once did anyone tell me that there was that sensation until I ended up in the emergency room with COVID. And then they were concerned. They put me in a CT scan and they pumped in the contrast fluid. I felt like my whole head was imploding. And I thought I
Yeah,
actually truly wet myself. And I was embarrassed. I thought, was this the
yeah.
COVID? Like, what made me just wet myself? I thought, am I really sick here?
No,
I didn't want to get up. I was mortified. And then I moved around a little bit and
no.
realized that
Some
it was
people
just
like it. Some
the
people say,
warm
"Hey, doc,
feel.
can I have another slug of contrast?" It's like, no. so, so anyway, so then, if you have really calcified, very small blood vessels in the leg, particularly below the knee, sometimes when the contrast reaches that area, or if you're using carbon dioxide, if somebody has kidney problems, then transiently the contrast is going to replace the blood and you will have lack of oxygenation to that area, and that can be uncomfortable. Okay, typically that pain will last for about 15 to 20 seconds. When I tell my patients, okay, if you're gonna feel that, just try to hold still while the picture is being taken, and then you wiggle your toes, and usually the pain dissipates. Okay, so that's the area of some discomfort. Then, when we are intervening, especially when we are doing the ballooning part, where we are stretching the blood vessel which was previously closed, and we're trying to stretch it open with the balloon, you can have some discomfort. Remember, there are no nerve endings inside the blood vessel. But when we're stretching, the nerve endings which are around the wall of the blood vessel, they can feel the stretch and you can have some pain. So again, remember that most of the times the balloon is going to be up for maybe 2 minutes, maximum of 3 minutes. And if you're having a lot of pain, then we typically will tell the circulating nurse to give you more pain medicine and keep you more sedated. So that's a step during the intervention when you can have some discomfort. Post-intervention, during the recovery, a lot of the times, at least in my practice, I put a plug in the artery so the patient can sit up early and then go home early, or we put a little stitch in the artery. But sometimes that's not possible. And then when you pull the sheet, you have to hold almost occlusive pressure. That is the step where you are going to have some pain, because what we are trying to do is um, press the artery against your sort of pelvic bone to stop the bleeding. Okay. And that pressure, typically, you will have to hold at least 20 to 30 minutes. Sometimes it can be longer depending on how much a patient may be bleeding, right? So, so if that is the case, then that 30 minutes is going to be very uncomfortable. And again, we can give you pain medicine during that time. Typically, we'll ask the nurses to give some morphine. And then you have to kind of lay on your back for 2 hours and then sit up and then go home. So people who have chronic back pain and they've been on the cath lab table for 2-3 hours, that can be uncomfortable. So that is sort of the intra-procedure and immediate peri-procedure stuff. When you go home, you can have some discomfort in the groin or in the foot where we access to get the tubes in. If you've had an intervention, whether it is balloon angioplasty or stenting, you can have some residual pain in the thigh or in the calf area. And you can have some swelling, especially if you've opened up a chronically blocked artery. That's called sort of post-perfusion injury. That's not uncommon, but it can certainly be very uncomfortable. So, if you have some Tylenol at home, you can take that, keep your legs elevated. Sometimes, if I know that the patient is going to be uncomfortable, I'll give them some analgesics like tramadol to go home with. I try to avoid opioids at all costs. Um, very rarely I'll give them just because A, sometimes it's not needed, and B, it's just hard these days to, uh, write for opioids, especially for more than 3 days. But typically, I just avoid opioids. So tramadol works better. And if somebody is intolerant to it, then I'll obviously use opioids if necessary. So these are the steps. And then typically 24 to 48 hours later, you should be able to walk and resume your normal activities like you were doing before the procedure. So I hope that answered your question. And, like every patient is different. They have their different pain perception. But, this is sort of the standard progression of the procedure when you are in the cath lab. So just don't be scared. Ask the questions up front. Ask the doctor when you are talking about, going through the procedure. So, okay, what is the plan? How are they going to access? Which artery they're going to access? Which side of the groin you're going to go through? What is the backup plan if they can't, open the blood flow? Are they planning on accessing the foot, or they're going to try, if they can get through the blockage, are they going to try one more time, or are they going to send you for a second opinion? So these are genuine questions which you should ask before you go to the cath lab.